Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. I'm really excited about today's story because so many of you know us as the creators of the Granite List from this podcast, but our company, Connect Healthcare Collaboration, or CHC, is focused on all facets of employee benefits, marketing, and driving employee engagement. And so one of our business lines is clinical advocacy, allowing us to use clinicians and nurses to guide plan members. So today's story is going to be about just that. Welcome to another episode of the Granite List Live, where we explore all things human capital and employee benefits related. I'm your host, Sally Pace, and today I am joined by Jenny Spring, who is the benefits manager at US Radiology Specialists. Jenny, thank you so much for being here.
My pleasure.
So excited about this particular story. Jenny, can you start by just sharing with our audience the plan member makeup of USRS?
Absolutely. So US Radiology is made up of about 500 physicians and 5,000 employees located across the United States. And they do great work in the imaging space. So we're very medically oriented to the clinical side of services. So with that population, I like to think that they have high standards because they know that side of the business and are in the business of helping patients as well. So my role is to help them as much as possible since they're really doing the good work.
Absolutely. And on your plan, you have both the employee and spouses and dependents, right?
We do. We're happy to cover all. We have about 40% of our employees take advantage of our medical plan. And there's a wide range of employee-only coverage, family coverage, spouse coverage. So it's a wide range. It's really just about what they need, and we're really glad that we're able to offer it all.
Well, and you do. You offer a tremendous amount of really great benefits solutions. But I know toward the end of last year and beginning of this year, you were looking to solve for a particular challenge. So do you mind telling a little bit about that story?
One of the things that came to light was that we had some of our employees who were on our medical plan who needed very specific medications. And as you know, sourcing medications can be very difficult. And even when you have a robust plan like ours, it can be very expensive for both the employee and for the employer. And we were able to learn more about what the actual issue was and really reach out to you all to find a partner who could help us. And the solution ended up being partnering with Global RX, a pharmacy source that allows us to get medicine to our employee or their covered dependent outside of all the red tape, right? So really more of a direct approach. And the services that were provided that way were just amazing. I mean, as you all know, as everyone knows, that there can be so many roadblocks to getting access. And my job is to remove as many roadblocks as possible. And RX Manage was able to remove even more.
And yet, even with this wonderful solution, you live this every day. So many of our HR partners live this every day. You bring this great solution to the table. And a recent study shows that 68% of employers feel like their employees don't take full advantage of the solutions offered to them. And I think it's fair to say you found yourself in that boat as well. So you got creative.
We did. And I was really thrilled that US Radiology was even open to being creative and open to trying new things to try to find the best care possible for our employees. So I was just thrilled with that. And then on top of that, we were able to partner with CHC, Global RX, and really find some solutions. A specific example that I can think of is we were having a difficult time reaching an employee who was needing medicine, but was so busy working that we were having a difficult time reaching them. And so we ended up sending a letter to this person's home, explaining a service that really could help them in a very meaningful way And it just so happened that when they, got their mail, opened the letter, read, a handwritten letter from, our nurse advocate explaining, we really can help you with this. This isn't a scam. This is really something that we can help you with. They immediately got on the phone and called the nurse advocate and got connected with some very, life-saving medication and saved the employee quite a bit of money and hassle. So just love to hear these stories. And, that letter writing idea was just solving a problem. That's really my approach is what's the problem that we're solving for? And that was the main, roadblock to getting this person some help.
And it is remarkable because I think the total plan savings is somewhere around $170,000, right?
Yes.
So 10 minutes at a time and a handwritten note had a massive, massive impact on the bottom line.
And let's not forget, right, the impact for my employee was thousands of dollars in savings because we were just eliminating all those, I say roadblocks, but also hurdles, constant hurdling to try to find a way to get this medication. And so it's just one of many fabulous stories that we've been experiencing. And I mean, I'm really just thrilled that we've been able to help our employees, but I really hope that, we can get the message out by having this conversation that this is not that hard. We just have to get aligned. And it's just a great solution for employees and employers.
Well, and I think, I heard through the grapevine that was just the beginning. Now there are a couple of more plan members and it's a handful. And yet it's a targeted close to $700,000 in savings.
Yeah. I mean, you can look at it either way. You can look at it from the employer's perspective. You can look at it from the employee's perspective. I like to point out both.
Yes.
The human story is these are people that, I know, as I said, they're located all across the United States, but just to have a really meaningful impact is a fabulous story. And I really want to make sure that we can do even more.
Yes. And you're right. I mean, I know from having that inbound communication and that conversation ongoing with the employee and other employees, the gratitude that they feel working for an employer that not only cares about offering these solutions, but is taking that extra step to make sure that they are educated and communicated to means a tremendous amount.
It's a huge relief for them. And just it allows them to focus on what's important, which is their health and the rest of their life, which is, working. They don't have to worry about, did I submit a form or did I call the right place? All of that has been taken away, eliminated, and it's just so much easier for employees. It's really the way it should be.
Exactly. Do you mind educating our audience a little bit on kind of, you don't need to go into the specifics, but the vendor stack makeup and also what led you to work with our clinical advocacy team?
Yes. So, it really started with as an employer, facing just staggering increases year over year. And we just thought we just can't accept this. I know that's the norm, but there's got to be a way to address this. And so we got connected with Wellnessity, who took a look at the data, right? Data, it's really all about the data. And the data was saying, yes, these double-digit increases in the medical plan spend and the pharmacy plan spend are staggering. However, here's some things that you can do to address it. And we just, addressed one thing, then we addressed another thing, and then they connected us with Connect Health, where that led us to our relationship and working with the nurse advocate. So the nurse advocate is just a fabulous conductor, really, in the orchestra of what we're trying to accomplish here. And that is, she is our main point of contact for employees. An employee calls her, and whatever the issue is, she gets that person connected with the resources that they need. Some of my favorite stories are, we had an employee who was recently diagnosed with cancer and called Nurse Andy and got connected with cancer support, second opinion, and some other services. And they were so happy about the nurse advocate that the employee reached out to me to share that story with me. So it is an unusual offering for an employer to provide this kind of service. And I was thrilled that the employee was happy enough to share it far and wide. And feels better, feels like, has someone on their side, because as we know, sometimes physicians are rushed. Sometimes they aren't connecting all the dots. And so the nurse advocate was able to provide those things for our employees. So just thrilled that support is available.
Yes. And, it's interesting because both of the stories you shared, I think in this day and age, there is such a focus on apps and, platforms and chatbots and all those things. But really the stories that you're sharing are human touch, high touch. It's not necessarily, everyone doesn't need it, but for those that do, having it available can be not only a game changer, but life-changing.
Yes. Yeah. And I mean, let's face it, just because there's more technology doesn't mean it's better. And being able to pick up a phone and actually speak to a human being who knows your situation and can help you is just, we're really getting back to basics, because that's what's necessary, right? We're cutting through the noise and just really focusing on being efficient and really getting the answers that people need.
Absolutely. Thank you again, Jenny, for sharing your story. It is such a powerful one, and we really appreciate your leadership. And for those of you that are listening that are interested in learning more about how CHC's clinical advocacy through nurse navigation can assist you in supporting your plan members, we'd love for you to visit chc-now.com, or you can email me directly at sally.pace@chc-now.com.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.